Thank you very much indeed, Tony, and we're very, very pleased with to be here and to be able to talk to a lovely mixture of people and to whom we hope that some of the things we say are going to be relevant. And what we would like to do is to both inform and engage you with the issue of building impact from the PPI contribution. And rather than doing a big summary of what's been happening in the PPI theme, what we want to do is to share insights from two of the projects, one of which takes an overview of PPI in the CLAHRC, and the other one of which is, in effect, a case study of some of the things that we're going to talk about. So I shall hand over now to my colleague, Dr. Elspeth Mathie from the University of Hertfordshire.
Thank you. Can everybody hear me? So the impact in the context of patient and public involvement. I'm now going to shorten that to PPI from now onwards. And when we talk about patient and public involvement,
Sorry, can you speak up or get closer to the microphone, please?
Patient and public involvement means getting patients involved in research, not as participants on a trial or a study, but in helping to research the study itself. So the structure of our talk today is that we're going to do a brief introduction and then, as Fiona mentioned, talk about two of our case studies, two of our research projects in the PPI theme, and then we're going to engage in an interactive activity to keep you awake this afternoon. So PPI impact across the research cycle. Many of you will know this involved research cycle, which illustrates possible PPI impact across the recycle from early in the process right through to the end. I ought to mention again, people use different terms for patient and public involvement. Patients, public, PPI representatives, lay users, all encompassing all the different people that can get involved to give a public or lay view to the research. They can be involved in all of the research stages, from identifying and prioritising research, what areas are important to research, asking patients what's important to them, helping to manage and design research, producing information leaflets and study protocol that's user-friendly, helping to manage the research, being involved in steering groups and advisory groups. They can be involved in writing the protocol. They can be involved in undertaking the research, doing interviews and analysis, helping us to find out what really is meaningful in the research and what do those findings really mean to patients. And also involved in disseminating, talking to community groups, making those findings go out into their communities through newsletters and patient magazines. And then also being involved in evaluating the impact. And these impacts, when we're talking about this in the context of PPI, can be intended and unintended. They can be short-term impacts or longer-term impacts. So what PPI impacts are being reported by the CLAHRC researchers? This is a quote taken from the KPI, the key performance indicator that all of us researchers in the CLAHRC are asked to fill in, and it's a good source of recorded PPI impact, and a couple of researchers have given us permission to use these quotes. So firstly, at the early stages of research in ethics and recruitment, this quote shows one way PPI can have an impact at the recruiting stage, helping to make materials user-friendly, accessible, using photographs and vignettes that can make just like the people described. PPI representatives can suggest novel ways how to best recruit people if you can't get people onto trials, and this is often viewed positively by Ethics Committee. Another example here that Sarah Ray, who will be speaking next, is involved is the Promise Project, and the service user involvement there was commented favourably by the Ethics Committee and also received ethics approval very quickly with a small adjustment. The poster's outside if you want to have a look more at that. A second example, just to give you a taste of some of this KPI, the PPI involvement impact, is data analysis, looking at the transcripts. What terminology is right when we discuss the transcripts, of using the right sort of terminology. And recent evidence, there have been some recent research papers that have discussed PPI and the difficulties of evaluating this impact, and whether we should even try to prove an impact if we believe it's a moral right to have patients involved. And two systematic reviews by Brett, published last year in 2014, looked at literature between 2009 and 2012, and the findings identify not only impact on research itself, but also impact on the researchers and on the PPI representatives, and also impacts on the wider community. So as well as being positive impacts, we also, maybe it's not talked about so much, as the challenges of involving PPI, and that's again something that we can talk about more, about researchers reporting difficulties of incorporating PPI in meaningful ways. service users maybe not having enough training to be properly involved, and the community feeling overburdened with the work involved. All sorts of different impacts. And here is a last quote from the KPI of a CLAHRC researcher who talks about the impact of PPI on herself, meaning that it helps her keep motivating by reminding us how important our work is. I'll now hand over to Sarah Ray, who will talk to you about the impact of PPI from the voice of a service user.
So Elspeth has just spoken about the impact of PPI on the researcher. But service users frequently appraise PPI as being worthwhile for themselves. In mental health especially, meaningful involvement can contribute to people's recovery and well-being. And in my case, it's improved my motivation and it's really given me a sense of purpose. Many service users have similar experiences, and that's illustrated by the quotes you can see. And these were taken from the Cambridge and Peterborough Foundation Trust Service User and Carer Research Group. However, today, I'd really like to tell you about the ways that being involved in research has benefited me personally. I've gained status and knowledge. And not only that, but when people who receive services are actively involved in projects, professionals see their abilities and not just their disabilities. And that helps to challenge stigma. In my case, it's meant access to further training and the opportunity to present at conferences. As a result, I've gained new skills and I've discovered some that I never knew I had. I've had the satisfaction of working as part of a team, having my views heard, and the chance to shape the direction of research. It's helped me to rebuild my confidence, which in turn has enabled me to be more open about my mental health challenges. Overall, it's had a very positive effect on my self-esteem and my self-belief, and that's given me the courage to take on other roles, such as working as a trustee for Mind and co-leading on the Promise project. One of the most rewarding aspects, though, I have to say, has been meeting other service users and getting to know researchers as colleagues. I've been lucky enough to make numerous friendships, and many of those have been inspirational. It's broadened my horizons, and it's given me the incentive to combat anxiety, especially as regards travelling and public speaking. Talking about my research activities in Europe was challenging, especially on the last occasion when I had to summon up the courage to travel alone. And last but not least, I should say, I've also been able to earn some money. And I'm now going to hand over to Julia, who's going to talk about the Impress project.
Thanks there to Sarah. Moving on. The Impress project. Impress stands for Researching the Implementation and Evaluation of Patient and Public Involvement in the CLAHRC East of England research. So our research is about the CLAHRC East of England, so its participants, so the researchers and the patient and public involvement representatives within the CLAHRC itself. So we're a little bit unusual in that respect. So what is the Impress project actually for? We've heard a little bit from Elspeth about how patient and public involvement in health and social care research, how there's evidence that good PPI actually enhances research. But when we try and implement or normalise PPI within organisations and projects, we're going to meet difficulties of communication and fit between PPI activity and existing values and routine practices. And we heard from Julian previously about how implementation can take 17 years, was it? PPI's been around for about 15 to 20 years now, but there are still issues with implementation. So setting up the new CLAHRC in the East of England gives us an opportunity to systematically implement PPI, to put some structures in place. Also to better understand what happens when we normalise PPI, and to better learn from each other how to improve PPI support and impact. There's been PPI throughout the CLAHRC before this one, but obviously we want to build on what we do well and find out where we can do it better. So we're talking today about impact. As an action research project, the Impress project is an action research project, we're actually looking to change things, to effect change. And the question of PPI impact is actually central to our study. We want to have PPI in the CLAHRC that makes a difference. So we're interested in exploring what PPI impact means from different points of view, so not just from the researcher's point of view, from the PPI representative's point of view. And we're going to explore this in the activity later. We're also interested in the barriers and facilitators to PPI impacting positively on studies and across the programme as a whole. And through our research process, we're hoping to develop agreed action plans that have consensus within the CLAHRC as to how we can make these things better. So the IMPRESS has its study design, its action research. We're going to observe, plan, act on and evaluate the PPI structures and processes within the CLAHRC. The action research model we're following has a bit of a pre-step. So at the moment we're gathering lots of information about what's happening on individual projects and within the CLAHRC more widely. We'll also, within our case studies, be collecting PPI data from the different projects to do with costs. So that'll be looking at the time that people invest in PPI within projects at each stage. And we'll be looking at from the time of the research team and the time of the PPI representatives. We'll also be using something called normalisation process theory. For those of you who are well versed in implementation science, that's one theory that can help us to look at how embedded something is. So how embedded is PPI within the different projects within the CLAHRC? PPI is also present in our project. So we have PPI co-researchers, 2 PPI co-researchers in our project. We have PPI members in our advisory group, and we've tried to link in with the regional PPI groups as well. So where are we with this at the moment? So we're in the first of 2 action research cycles that we have planned. The first one should be finished hopefully by the end of this year. So far we have sent out a questionnaire survey to lead researchers of projects within the CLAHRC to ask them about the plan types and levels of PPI and the resources they have to support their PPI. So that went out a few months ago, and we're just putting some of that data through further analysis. The poster outside, if you get a chance to have a look, reports some of the initial findings. We're also looking to recruit case study projects. So at the moment, I've been contacting a few people to try and start to get those case study projects up and running. So we've got a sampling framework that we're using to decide which projects to approach. So we're looking for 8 to 10 different case study projects, so we can start to unpick some of the PPI processes within each of them. So within those case studies, we're going to be conducting semi-structured interviews with the researchers and the PPI representatives about the levels and quality of the PPI. And we're going to then run focus group discussions. So if there's specific issues that are coming up across the CLAHRC, we can start to address those in different groups. We're also going to ask people to keep the logs of the PPI costs. The analysis of all that data will then help us to compare what works across different project types, across different methodologies, and to come up with some findings there. And it will also help us to draft an action plan for the next 2 years of the PPI in the CLAHRC. And to do that, we're holding 2 consensus stakeholder events. We've just held one to discuss some of the findings from the survey and to get some validations to the IMPRESS study methods and focus. And there'll also be one later down the line, probably towards October. So this is our 4-year plan. At the moment, we're just in years 1 to 2, so cycle 1. Just to say a little bit more about normalisation process theory, for those of you that are really interested, there's quite a good accessible website you can look up. And Carl May is the sort of originator of normalisation process theory. The reason why we've used this in particular is because it really focuses on the work that people need to do to embed something. And it breaks that work down into 4 different constructs. First of those is coherence, and then there's something called cognitive participation, and then collective action, and something called reflexive monitoring. So I'm going to say a little bit about how we're applying those constructs within the IMPRESS project. So coherence, or sense-making for short. So that's about understanding PPI in the CLAHRC as different to PPI in other contexts. And it's also basically just about people's understanding of PPI. What do they see it as being, and how do they understand it? In terms of cognitive participation, is there a buy-in to the work required to make PPI work? So do the people on the project, are they committed to it? Do they understand what it is, and are they committed to it? Collective action, actually doing the work. Are people doing what they say they'll do? Do people turn up to things? How do the jobs get allocated? Are they suitable for people who've been asked to do certain things? And then reflexive monitoring. Are projects evaluating whether their PPI is working? They may have a great plan for PPI at the beginning, but it may need tweaking along the way. So the last part of that, the reflexive monitoring, is where impact really comes in. That's where we'll be able to gather some of the data about whether the PPI within projects is having an impact. And each of the 4 constructs of normalisation process theory also has 4 components. I won't go into the detail of those, but just for you to have a sense of the sorts of things we'll be asking case studies about. So systematization, do they have systematic ways of assessing their PPI? Are they formal or informal? Communal appraisal, do they discuss it amongst themselves, amongst the team? Is it working? If not, why not? And finally, do they reconfigure the PPI that they have? So what impact will we have as Impress? So hopefully at the end of the first stage, and of stage 2 we'll have other impacts, but just for now, for stage 1, we should have a research-informed and stakeholder-agreed PPI action plan for the last 2 to 3 years of the CLAHRC. We should produce a paper, which the title that we've come up with so far is Embedding PPI within an NIHR CLAHRC, Interim Findings, and we're going to target that at implementation science. And then finally, any sort of distinctive tools or guidelines that we're able to produce from the analysis, we can disseminate through academic conferences and peer-reviewed journals, but also through practitioner conferences. And obviously we have networks with things like Involve and with RVAC, which is the Association for Research in the Voluntary and Community Sector. And we also have links with the local PPI groups. There are several in this area, and we've also invited them to our stakeholder events. And finally, this is just a picture of the research team. You might get to know some of us, especially for your case studies. So the 4 people on the left are the contract researchers. The 2 people in the middle are our co-researchers, our PPI co-researchers, who'll be involved in the focus groups and analysis of the data. And they've been involved all the way through at different points as well. And then we have the research co-apps and CIs, and Lisa Irvin, who's going to help us with the health economics component. That's it for now. I'm going to pass on to Kathleen, who's going to talk about REACH.
Thanks very much, Julia. Is it picture down? There. Hello, I am speaking about something that's live in terms of impact of PPI, and I'm one of the members of a very collaborative team for the REACH study. That's the acronym for Residents Research Active in Care Homes. And very quick snapshot that what REACH is involving, all of us, our PPI members and ourselves, is a study that is trying to determine the facilitators, the barriers to the involvement of residents in care homes in the research process. And REACH has 3 principal components. They are initially, this is being completed, a systematic review of studies that have involved care home residents. Then the stage in which we're live at the moment as we speak is the recruiting of participants, be they residents, be they staff in care homes, in focus groups and interviews to give us their thoughts on what it might mean to engage and participate actively in research, or what might be a hindrance to that process. And the evaluation, the third of those components, is we are right from the start of REACH and towards its end trying to keep track of how as a team we function together. And at the end we're hoping to produce some guidelines that will inform future research that takes place in care homes in order to improve outcomes. But specific for this afternoon's context, I acknowledge it's a rather busy diagram, and it's trying to represent the impact of the different relationships and stages and functions of the study. It makes an impact on the PPI members, represented as it were by the faces, as well as on the organizations, the care homes involved. And there are different layers and types of participation and involvement. For instance, our PPI members, when we recruited them, they were given the choice, do you want to be a collaborator, or do you want to advise us? Do you want to come to the university for team meetings? That just gives you a little flavor of the different choices our PPI members had in terms of their collaboration with us. And then aspects such as relating to and interacting with different stages, including ethics, the appropriate documentation. And of course, our whole hope is that this is going to inform not just the research community, but have a ripple effect in society as a whole. So what are examples when we hold our team meetings actually at the university? I think I speak for all my quote-unquote academic colleagues that we do find ourselves much more often in listening mode than might otherwise be the case. I, for one, think that is a good thing. I myself find that I am being challenged. I'm being questioned in very constructive ways by how a question might be echoed back to me, or just saying, what does this mean? Why are we doing what appears to be a repeat of what we did the last time we met? It shifts the dynamics of how all of us as a group operate, and I firmly believe it actually results in fruitful outcomes, given that everybody who is there does appear to be very committed and committed to and interested in what they're doing. So other points I want to stress from this list, because I'm very conscious it's not very visible from about midpoint way of the room, is one gets very much a sense of university-based meetings of the shifting of the focus. Maybe an agenda isn't followed the way it was originally intended because different viewpoints and voices are aired. And we, as researchers, academic-based researchers, are made very familiar with the different types of priorities that are brought forward. How do we express ourselves, both in written form and as well as verbally? A lot of our hard copy material we have actually put to our PPI members and said, we'd really value your recommendations. Have we got the right balance between a mix of text, diagram, and other types of images? One of our PPI members, we have 6 on board, is one of 3 people who are care home residents. And when I showed her an example of what we're calling a summary of research to present to people when we are doing or recruiting for our interviews, we're trying to strike the right balance. And it was very helpful when she fed back to us that she felt like things such as the font size, the spacing on each individual page, and to hear her say, I think this is probably about the right balance. So on the one hand, she said, you don't want to patronize people while at the same time trying to engage them. That sense of being meaningfully involved from the PPI point of view and the impact they make means that what we are doing, our processes, I believe, are more transparent, which actually makes the research more valid. Some of you may have spotted a point on there about the emotional impact on team members, and perhaps some of you spotted in the previous slide that some of those faces weren't smiling. Sometimes there are difficulties, either about, I want to get on to the next agenda item, or a team member say, I need to have this repeated. And while there were a couple of faces there that didn't look happy, what we would like to suggest and put out in the public domain is indicative of people's commitment to the process and that they take what we're doing on REACH very seriously. We, on 2 occasions, have had an example of holding our team meetings at care homes, and I think this is a very key part of impact that's made, because here it's not restricted just to the REACH collaborative team. Here, by definition, the research is spilling out into the venue of the care home. That means that the staff in the care home are having to make some adjustments to their own schedules to accommodate us, to set up a table or 2 or 3 tables for us and bring us tea, which they very generously have done. Another point I want to highlight from that list, it says other residents joining. In our March meeting that we held at a care home, we were all quite pleased. We're very conscious of the fact that we are in other people's home as we conduct our research. Again, the PPI members are some of the residents in that care home, and yet that did not appear to deter or prevent a couple of other residents pulling up a chair and joining in. We actually found that very validating to the nature of what it was that we were doing. So dynamics are fluctuating on a fairly frequent basis. Researchers are very much in guest mode, and if one is a self-reflective practitioner, I think you can't help but find that a good and just think, gosh, some shifting of the power. I'm actually here as somebody's guest. I'm not controlling the events and how they unfold. So again, this constant questioning takes a lot of shapes, and that's just one example of them. There is a financial impact of PPI. One needs additional resources to allow for particular transport needs. Time is a financial resource. You have to allow time to communicate. The value of making a telephone call. Remember that came up in our first session. That's absolutely true for maintaining good relationships with PPI members, not just in terms of this is the information we want you to consider or to choose whether or not you want to consider it. Making things accessible, as I mentioned earlier, about font sizes and mixing text and image. Our partner organizations, as I just mentioned in the previous slide, we have to allow for the fact that there's an impact on staff costs, the provision of refreshments, the fact that residents there are suddenly made aware, gosh, something is happening in my care home, and what that might mean. So we'd like to suggest that the impact of PPI on research is very real. By making resources more accessible, we feel our research becomes more valid. By including the voice and perspectives, the active, meaningful collaboration, even if from time to time there are certain emotional dimensions, grounds that research in a hugely important way. There are huge benefits to recruiting in our current phase. We're having focus groups and interviews. Our information sheet has a photograph on it which includes our PPI members, and being able to point out on that, here are 3 members who are actually resident in care homes, appears to give REACH a lot of street cred. And there are ripples in the community. Our PPI members include 2 older people, independent, living in the community, as well as a deputy care home manager. And it does increase the horizons, the knowledge, the awareness of what we are doing on REACH. So if I were to close, I think I could echo some of the points that were made earlier, that our study, as an example with PPI impact, makes research live. And I would like to suggest something I think Carol said this morning about trying to tap into a research-aware workforce. What we've been doing so far and will continue for the next few months, I believe that is also another important effect of REACH. Thank you.
So in terms of impact on research, the kinds of things which have emerged have been, for instance, making research more user-friendly, improving its relevance, improving recruitment rates, all dear to the hearts of researchers, of course, and people who want research to have an impact, but having the minuses that it can actually reveal divergent views about the research itself and about what is appropriate research and what advice can look like. And of course there's the one about, does it simply slow research down when there is pressure on research? In terms of the impact on the PPI rep, the service user, and I think we've had a number of accounts which have sort of confirmed that it can be a way for them to gain confidence, to be empowered, to be valued, and to actually gain in life skills. However, that's in a good PPI supportive environment. So in fact, sometimes the impacts can be contrary to that and can mean that PPI reps are not enabled to contribute to research, and that they may be overburdened with work. And that thing about reasonable commitment is something that actually needs careful consideration. The impact on the researcher or the health professional can be about actually having a greater understanding of research areas, so very relevant to those issues of collaboration, co-production, that we have been hearing in earlier theme presentations today, gaining respect and good rapport with the community, and also reminding us why research is important, because when one has PPI, the reasons are there talking with you about why this research might be important to carry out. And also, as a minus, that reminding one that it can be difficult to incorporate PPI in meaningful ways in particular settings. And then finally, and importantly as well, the impact on the wider community, meaning that it's a way to get to particular communities of users, and that community involved might become more aware and knowledgeable about their condition. But again, there's this issue about, in some circumstances, overburdening them with work. So I don't know what you've put on your sheets. One of the things that we'll be able to do is to compare the kinds of things that you've put on your sheets with what the wider literature is beginning to tell us about PPI. But we do hope to make sure that we learn the lessons, we think about what's going on with the CLAHRC and its partners. And one thing I would like to say, for those of you who've been contacted about contributing in press case studies, we hope that you've actually had a very clear indication of what your researchers, your PPI members can gain in terms of constructing your own impact case studies, your pathways to impact, and understanding what it might mean for you to evidence good PPI in your project. So if you're contacted by the Impress team, please make sure that you're part of it. Okay, thanks very much indeed.